When we look at terminology describing spinal position, scoliosis is very easily understood as being an S-shaped curvature of the spine that has rotation that you see from the front or from the back. Meaning where the spine is supposed to be straight, now we have these curves. However, one confusing word for patients to understand is something called kyphosis. And kyphosis typically refers to hyperkyphosis of the thoracic spine, where we have too much rounding of the mid-back, and the patients look rounded in the shoulders or kind of hunched in the mid-back. However, kyphosis can also refer to a curvature that's bending the wrong way in the neck or the low back. In your neck or your low back, you should have from the side a forward-facing curvature. Well, if you have it bending the wrong way, it can also be a term of kyphosis. That's something called a cervical kyphosis or a lumbar kyphosis. But generally speaking, when a patient is told they have kyphosis, and they have scoliosis, they're normally talking about a thoracic increased kyphosis. I mean, it's gotten too large. Now, all these cases are structural spinal deformities that must be addressed in a structural manner to help improve the symptoms and presentation of each of these types. So we only recommend early diagnosis, normally means early treatment, which normally means best possible results. If you're diagnosed with these issues and you're told just to leave it alone, not worry about it, in many cases, these things can worsen to then eventually will lead to more invasive types of treatment.